Hi, my name is Mallory Rose, and I will be going through two different case studies with you. So the first case study I chose is case number 1, and the question says, a newborn girl appeared normal at birth, but within 24 hours she developed lethargy, hypothermia, and apnea. The attending physician suspects a metabolic disorder and orders a panel of labs. Which diagnostic would be the best to distinguish between a urea cycle disorder and a disorder in beta oxidation? Please discuss your rationale for this choice. So the 4 diagnostic tests that we were given to choose from was blood glucose, urinary acids, serum fatty acids, and plasma glutamine. In my research, I found that more than one of these diagnostic tests would be helpful, and I felt that in a practical setting, a doctor would use more than one diagnostic test to be 100% sure they are diagnosing the patient with the correct disease. The best option I chose was plasma glutamine test. There are a few good ways to diagnose a urea cycle disorder, and one way is by looking at ammonia in the blood and amino acids in the patient's blood and urine. The best test that would be used to diagnose a urea cycle disorder would be plasma glutamine. Glutamine helps with transporting ammonia, and to diagnose a urea cycle disorder, ammonia is examined. In a person with a beta oxidation disorder, their glutamine levels would be normal. The next test, the blood glucose test, would also be a good test because glucose levels are in the normal range for people with urea cycle disorders, and people with fatty acid beta oxidation disorders do not present with a normal blood glucose number. The next test is the urinary acid diagnostic test, and this could be helpful in diagnosing a urea cycle disease. One of the diagnostic tests that is used to diagnose a urea cycle disorder is a urine organic acid test. This test helps to measure how well the urea cycle is working in the patient. It also helps to measure uric acid and how that could affect the urea cycle. The urinary acid test would not be extremely helpful in a beta oxidation disorder because the urinary acids would be harder to do a diagnostic test for, and this is rarely the first option to test if someone is suspected of having a beta oxidation disorder. The last diagnostic test option is the serum fatty acid test, and this wouldn't be the favorable diagnostic because the level of serum fatty acids in the body could be elevated for various reasons outside of a beta oxidation disorder or a urea cycle disorder. An example is that serum fatty acids are elevated in people that are obese. The next part of the question says, a full blood work up was ordered for this female and the data is presented below. The initial blood ammonia level was elevated at 314 micrograms of lead per deciliter of blood, and the normal range is 17 to 80, and then the patient's blood ammonia level rapidly rose to 600 micrograms of lead per deciliter of blood. The uric acid level was markedly elevated at 473 micromoles per liter creatine, and the normal range is 0 to 3, and the plasma citrulline level was normal at 10 micromoles per liter, and the normal range is 12 to 55. In this patient where uric acid levels are elevated, list one urea cycle enzyme that is most likely deficient and one urea cycle enzyme that is least likely to be impaired. The urea cycle enzyme that is most likely deficient in this person is the ornithine transcarbamylase enzyme, shortened to OTC. One of the symptoms of a deficiency in OTC is the accumulation of ammonia, and it can be confirmed that the patient had a very high ammonia level of 314 micrograms of lead per deciliter of blood, and then it quickly rose to 600 micrograms of lead per deciliter of blood. A normal range is 17 to 80 micrograms of lead per deciliter of blood, so the person is very high above that. Also, in infants with the OTC deficiency, their plasma citrulline level is usually normal and in trace amounts. The least likely enzyme to be impaired is the carbamoyl phosphate synthase 1 enzyme. This is because in an OTC deficiency, CPS1 is either increased or is maintained at a normal level. Excess CPS1 is also converted to orotic acid, which leads to an increase in urinary orotic acid that is excreted. A buildup of this can lead to an increase in ammonia, which we can see does happen in the patient. Case number 3 says, a 47-year-old man presents with severe pain in his right great toe. He is unable to bear weight on his right foot and there was no apparent trauma. He reports the pain started last night and continued to increase in severity. Based on his physical exam and laboratory findings, he is diagnosed with gout. Gout can be caused by several different mechanisms and blood samples are drawn and urinalysis is performed. The results from this individual are listed below. His results show that his plasma urate level is 10.5 milligrams per 100 milliliters and a normal range is less than 7 milligrams per 100 milliliters. His blood test also shows that his urinary uric acid level is 250 milligrams for 24 hours and a normal range is 412 plus or minus 78 milligrams for 24 hours. After further discussion with the patient, he tells you that he recently switched from diet soda to regular soda because he read that the fake sugar diet soda was bad for him. He tells you he drinks between 4 and 5 liters of soda a day. Note, the primary sugar in most sodas is fructose or high fructose corn syrup. Before I get started my answers and explanation, I think it is important to point out the amount of pop that the patient is drinking daily, as this is an important factor. The options given for a possible cause of why the patient has gout are 1. Overproduction of purines, 2. Decreased salvage of purines, and 3. Decreased urinary excretion of uric acid. The first option, overproduction of purines, is not the correct answer. It is not correct because the patient isn't producing enough purines in the body that they are converting to uric acid. We know this is true because his urinary uric acid test is rather low, and that would give us insight into the amount of purines in his body. If there was an overproduction, then his urinary uric acid test would have a higher result than just 250 milligrams per 24 hours. The second option, decreased salvage of purines, isn't correct either. The patient does not have decreased salvage of proteins. If he did, he would potentially present with Lesch-Nyhan disease. The salvage of purine generates uric acid. If we have a decrease in the salvage of purines, we would also have a decrease of uric acid. A decrease in uric acid is the opposite of what we see in this patient. In this patient, we see a uric acid level higher than normal. This is why the answer is not option 2. The third option, decreased urinary excretion of uric acid, is the correct answer. One clue as to why the patient has gout is that his plasma urate level is higher than normal. A person without gout has a plasma urate number of less than 7 milligrams per 100 milliliters, and the patient has a plasma urate number of 10.5. One of the symptoms of gout is lower excretion of plasma uric acid. We also know that option 3 is correct because the patient does have a decreased urinary excretion of uric acid. The next question states, what is the potential impact of this dietary modification on the presentation of gout? This question is referring to the patient switching from diet soda to regular soda because he read that fake sugar diet soda was bad for him. He also mentions that he drinks 4 to 5 liters of pop a day. Gout is associated with the consumption of too much sugar, specifically fructose and high fructose corn syrup. Purines are released as our body breaks down the fructose. Uric acid is produced as the purines break down in our body. Uric acid is then what ends up forming the crystals on the joints of people with gout. There was also a study done by the Arthritis Foundation that found that men who drink more than 2 sugary pops on a daily basis are 85% more likely to get gout than men of the same age that drink about 1 pop every month. Thank you for watching, and I hope you have a good day.